Thank you for having me. I'm thrilled to be here. My name is Dr. Varun Choudhary. I'm the Chief Medical Officer at Talkspace, the leading behavioral health company that connects people to a network of licensed therapists and board-certified psychiatrists from anywhere. In my role, I have oversight over our clinical practice, including our full-time national provider network and a network of thousands of independently contracted therapists and providers. Prior to joining Talkspace, I had spent 10 years in patient care and had incorporated telepsychiatry into my practice in 2006. Subsequently, I spent 7 years in managed behavioral health care and was the National Chief Medical Officer of Behavioral Health at Magellan Health before joining Talkspace over a year ago. Before I get into the formal presentation, I'd like to share a story of a colleague I trained with at the Medical College of Virginia Hospital. This is Dr. Lorna Breen. For those of you who are not familiar, Dr. Breen was an accomplished physician. She worked at the New York Presbyterian Hospital in Upper Manhattan, where she supervised the emergency department. In the first wave of the pandemic, her unit turned into a brutal battleground. Here she was in the midst of her life's calling, and she was now suddenly helpless with a very real and rising death toll. Not to mention pure exhaustion. In one shift, she worked 15 straight hours. As the weeks went on, Breen, who was a dynamic and passionate person, became a shell of herself, and she ended up having to check herself into the University of Virginia Medical Center's psychiatric ward. Shortly thereafter, she died by suicide. Dr. Breen inspired the Safe Haven program created by the Medical Society of Virginia. Safe Haven was founded in 2020 and later signed into law after recognizing a greater need to provide healthcare workers the support they need to stay well and prevent burnout. I share this extreme and tragic case because it made waves throughout the nation and underscores the trauma that's been felt collectively by our frontline heroes. Today, we'll cover 3 areas, including research we have not yet published on how asynchronous therapy was useful to a population of frontline healthcare workers at the onset of the pandemic. I mentioned a little bit about Talkspace already, but I wanted to provide a bit more background on what we do and who we are. The theme of this year's Champions of Wellness Conference is sparking organizational change in healthcare. This is something Talkspace is part of as more and more payers, schools, governments, and large employers are prioritizing mental health at an organizational level. Talkspace has thousands of licensed providers across all 50 states, made up of our full-time Talkspace therapists, our national practice providers, and our independent contractors who are working more flexibly, sometimes supplementing their own practices. We are committed to research in order to validate the efficacy of this treatment. We have numerous studies published in peer-reviewed journals in partnership with leading academic institutions. And through the course of nearly 10 years, we have collected ample data to further enhance and expand opportunities for this treatment modality. Now, let's talk about some of the research we've done relative to the impact of the pandemic on healthcare workers. The pandemic tested new norms for everybody, for working parents, for teachers, educators, and especially frontline healthcare workers. A survey by the U.S. Census Bureau found that clinically significant symptoms of anxiety and depression tripled among U.S. adults as a result of the pandemic. One study cited that nearly 2 out of every 5 Americans noted some mental health impact as a result of the pandemic. I don't have to remind this group of the disproportionate burden on healthcare systems and hospitals. You may have had family members, friends, or colleagues affected by it. There were a number of factors that disproportionately impacted healthcare workers as listed here. All of these factors combined to lead 1 in 5 doctors and 2 in 5 nurses intending to leave the practice or the profession altogether. The difference from others in the Great Resignation period is that they intend to leave the practice, not merely switch jobs. These problems persist, and we know there's a significant national shortage of nurses, doctors, and other healthcare workers. Let's look at some of the research in this area to better understand how we might be able to address these challenges. Specifically, let's look at research involving asynchronous therapy. I will share unpublished data that we've conducted with a population of frontline healthcare workers using asynchronous therapy. But first, what is asynchronous therapy? Talkspace is a telemental health platform that enables licensed psychotherapists to deliver care through asynchronous two-way messaging methods, including text messaging, audio messaging, and video messaging. Talkspace pioneered this technology 10 years ago. You can text, audio, or video message with a licensed therapist around the clock. It's like being in a conversation with someone throughout the week, a trusted friend, and the room is always open to you. Let's look at the benefits of asynchronous therapy. There are still a myriad of financial, cultural, and accessibility barriers that prevent too many people from getting the care that they need. While we've made significant progress, stigma is still a primary example of a factor that serves as a barrier to seeking and accessing mental health treatment. On our platform, members fill out an assessment and are matched with a therapist in their state of residence that fill their needs. Once matched, they're able to communicate with a therapist in a secure, private virtual room. The user has access to send a text, video, or voice messaging at any time. We also offer live telehealth sessions. All communication in Talkspace rooms are protected and fully encrypted. We are compliant with all HIPAA privacy and security requirements. Now about our research, which we will publish later this fall. Dr. Derek Hull, our head of clinical research, in collaboration with NYU and Cornell Tech, undertook a study to understand how asynchronous therapy might be beneficial to this population. We followed a cohort of 1,873 healthcare workers from multiple US states who engaged in messaging therapy during COVID-19, starting in March 2020. These users included physicians, nurses at several levels, residents in training, and a small number of non-medical sanitation workers. For this study, we were able to leverage machine learning capabilities for what is called NLP, or natural language processing. This is the ability of a computer program to understand human language as it's spoken and written. Data suggests clinically significant improvement in healthcare workers with diagnosed primary anxiety or depression from baseline to 12 weeks. We found that there was a 56% clinically significant change. And the improvement shown by healthcare workers translated into a large effect size that puts it on par or higher with effect sizes reported for traditional therapy. This is a very strong response on the upper end of outcomes we tend to see, suggesting an especially good fit for this population. Our other main takeaways here. This sample was more severe at baseline than our historic user base. It's clear from the analyses that roughly half of the healthcare workers sought care for problems that predate COVID and saw that this was an opportunity to finally begin treatment. For the other half, concerns about bringing COVID home, experiencing patient deaths, they were both significant factors of stress leading to depression, anxiety, and panic attacks. Of course, we can take ourselves back to remember those initial stressors during the first wave of COVID-19. In analyzing the data, we got a sense that many of these messages were sent by healthcare workers while they were at work. We scanned a lot of present tense verbs, suggesting that the messages had been done from work and the therapist may have had a lifeline that they otherwise would not have had. Now, let me give you an example of this research in actual practice. Maine Health is a healthcare system that is the largest network in the state and has consistently faced higher than national COVID surges. They brought in Talkspace in April of this year to supplement the services provided through their EAP. The majority of users, 75.6%, were matched with an available therapist licensed in their state within 48 hours or less. This is remarkable when compared to the 6 to 8 week average wait for a face-to-face mental health services appointment. The top presenting problems include anxiety, depression, stress, and relationships. The early data we have back from this initiative suggests the majority, 67%, showing improvement. We know our employees are stressed, so our mission is to identify why and what can be done about it. From March to April 2022, we fielded our own survey of 1,400 full-time employees and oversampling 817 working parents. Looking at key highlights, around 1 in 2 workers are burned out or find work too stressful. The presence of burnout and stress has remained steady with levels seen in the July 2021 survey. Additionally, a majority of those who are burnt out or stressed say it's gotten worse in the last year. The good news is here. Mental health services can help retain workers, especially parents, younger workers, and those considering quitting. Of the population considering quitting, 66% noted they would stay if there were more mental health services. Other key takeaways. A supportive manager makes the difference. 86% feel more fulfilled at work under a supportive manager. 70% of workers actually feel more comfortable talking about work stress to a therapist. And 80% would reconsider staying at the job if there was more PTO. Beyond access to mental health services like therapy, how can we actively create a culture of acceptance, self-care, and wellness at our organizations? As we wrap up with a look at some of the things we can do to address these pressing mental health challenges, I want to first circle back to Dr. Breen. The tragic story involving Dr. Breen, in the end, has become a story of recognition and hope. The Dr. Lorna Breen Healthcare Provider Act was signed into law March of this year. This bill helps promote mental wellness and behavioral health for those working on the front lines of the pandemic. It also supports training and suicide and burnout prevention, and increases awareness and education about suicide and mental health concerns for healthcare workers. This act also serves as a driver that should help spark our own efforts. Let's look at what some of these important efforts involve. What does this mean for us as employers, managers, and human resources professionals, as leaders? The great reexamination and resignation is still real. Workload timelines and excessive oversight are key stressors. Serious conversations about mental wellness are both relatively rare and highly beneficial. Time off is a tool for mental wellness that's highly popular but underutilized. What are things we can do now to address these issues? As leaders and colleagues, we need to understand that the Great Resignation is still real, but we also need to recognize that other more traditional issues, like career growth and pay, for example, remain as stressors. Showing genuine empathy and care to one another and taking the time to actually listen is so important. We need to train managers, for example, to build trust and continuous communication. Maybe holding office hours to become a resource to their team members. But this just can't fall on managers. We need to offer and promote the use of trained mental health professionals to help manage work-related stress and burnout. We've observed through our survey an overwhelming demand for more PTO, yet a significant percentage of people do not use their allotted PTO. And sure, you are encouraging it throughout the year and that you are taking it too. Also, as a daily practice, encourage that blocks of time are devoted to self-care activities. For those in service of patients and clients, it's an absolute necessity to recharge. Finally, the culture of acceptance and self-care starts with ourselves. First, granting ourselves the permission to prioritize our own mental health and wellness is vital to success. Thank you to the organizers for having me at Champions of Wellness, and to you for committing some of your time today and allowing me to share here.